Hi.
Hi, my name is Malia. I'm going to be your nurse today. Can you
Okay.
tell me your name and date of birth for me?
My name is Kay Hendon and I was born on 06/13/06.
Alright, sounds good. I'm going to check your wristband and make sure that checks out. Alright, perfect. So before we get started, I'm going to do some hand hygiene. I'm going to provide some privacy for us. Can you tell me why you're here?
For a physical assessment.
And do you know what today's date is?
September 21st, 2025.
Alright, just from the first minute of this interaction, I can tell that your gait is steady from watching you walk in here. Your posture is erect. Your speech is clear, and you are alert because we're having an active conversation from your hearing. And your effect is calm and cooperative. Before we get started, I'm going to do a skin assessment first. All I'm looking for is to see if I see any skin discoloration, which I do not. I don't see any wounds, bruises, any inflammations. Your skin is warm and smooth to the touch. I don't see any signs of polar, kenosis, edema, or any lesions in your extremities. Alrighty, so now I'm going to check a look at your face. I'm going to check for symmetry. I don't see any droopages. Everything seems normal. I'm going to check your ears. Let me know if you feel any tenderness.
No.
And I don't see any redness. I'm now going to check your eyes. Alrighty, and if you could just look at that and look at my pen. Alrighty, your pupils are equally round, light, reactive, and accommodating. If you could pull your eyes down for me. Alright, your conjunctiva is pink and moist, your sclera is white, and your cornea is clear. Alright, now I'm going to check a look at your mouth, if you can say ah. Alrighty, your musculus is pink and moist, your uvula is midline, and you have normal dentation. Alrighty, now I'm going to check the ring of motion in your neck. Can you move it to the left? Can you move to the right? Can you push against my hand? Alright, on this side. Perfect. Alrighty. And now I'm going to check your nasal. If you can breathe in for me right here. And do it on the other side. Perfect. Was that easy for you? Alright,
Yeah.
perfect. Alright, now I'm going to check your carotid pulse. Alright, +3 bilaterally, which is good. I'm now going to check for some worries in your carotid pulse, okay? With the bell of my stethoscope. Alrighty, everything sounded normal. I didn't hear anything irregular. I'm now going to check your brachial pulses. Alrighty. +3 bilaterally. Now I'm going to check your radial pulse. And I would also say those are +3 bilaterally. While we're here at your arms, we're going to do range of motion and do strength. You can pull them out for me. Can you pull them in? Can you wiggle your wrist, your fingers? Alright, now hold onto my fingers. Alright, perfect. Alright. So while we're here, I'm also going to check your anterior lung sounds. If you'll just breathe in for me. Okay, for those anterior lung sounds, everything sounded normal. I didn't hear any crackling or wheezing, and it seemed eased and unlabored. I'm now going to check your heart sounds. I'm going to check your aortic, your pulmonic, your Erb's point, your tricuspid, and at your mitral point, I'm going to also take that heart sound for your atrial pulse for a full minute, okay? Okay, while I was listening to your heart sound, everything sounded normal. I didn't hear any extra sounds or any murmurs. And whenever I was auscultating your apical bolts for that minute, I got 74 beats per minute, which is a normal range of 60 to 90 for an adult. All right, now I'm going to check a look at your posterior lung sounds. If you'll just turn around. And if you'll just breathe in for me, okay? Alright, those posterior lung sounds also sounded really good. I didn't hear any wheezes or cracking. And I'm also going to check your capillaries and your fingers. And I do see that you have artificial nails on, which is fine, but I can still check it this way. Alrighty, less than 3 seconds. Less than 3 seconds. Alrighty. And I'm also going to check your reflexes and your knees, okay? This one. Alrighty, perfect. Alright, now if you'll just lay in a 45-degree angle for me, just lay your head against that door. Alright, I want to check for JVD first. Alrighty, no JVD is noted. If you will just pull up your stomach for me, I want to check a look at your abdomen. Your coloration is good, your skin is warm. I don't see any bruises or anything. I do see that you have a piercing there, but that shouldn't get in the way of this assessment. Alright. I'm now going to listen to your bowel sounds. Alright, those bowel sounds were active and nothing abnormal. I'm now going to listen for worries in your vascular pulse with the bell of my stethoscope. Alright, perfect. That sounded normal. I didn't hear anything abnormal, and there were no worries noted. Now I'm going to feel. Let me know if you feel any pain or tenderness, okay? Anything? Okay, perfect. Alright, I'm going to pull your shirt down for you. Alright, now we're going to check range of motion in your legs. If you can just pull that out. Alrighty, other side. Can you bring those legs into your chest? Right, other side. Alright, can you wiggle your ankles for me? And wiggle your toes. Good. Alrighty. I'm now going to check strength in your toes. If you can just push against my hand. Okay, perfect. I'm going to check for capillaries in your toes now. Alright, less than 3 seconds. Less than 3 seconds. And now I'm going to check for kenosis. All I'm going to do is move your foot around, and if it doesn't twitch, that's fine. Alrighty, no kenosis. Perfect. I'm also going to check your pulses down here in your feet. I'm not going to be checking your femoral pulse, but if I did, I would check right here. We're not doing that just for privacy reasons. Alright, so your doralis pedis is right here. We'll check that. Alrighty, I would say +3 bilaterally. Now I'm going to check your posterior tibia, which is right here. Right, I would say +3 bilaterally. And I'd say that is +3, and those would be bilaterally. I think that concludes the rest of our assessments. Do you have any questions for me before I leave?
I'm good.
Alrighty, I'm going to make sure your bed is locked and in the lowest position. Your call line is within reach. Your rails are up as appropriate. I'm going to maintain HIPAA, and I'm also going to perform some hygiene before I leave, before I go document. And again, no other questions? Alrighty, thank you, Miss Kate. You have a great rest of your day.
Thanks.